the insurance model is, I call it the sick care model. You go to the doctor because you're sick. The insurance, because people say, well, first question I always get is, will my insurance pay for that? Well, your insurance pays for you to be sick. It doesn't pay for you to be well. So when we're moving to a well care model, we're really looking at a patient-centered approach. One of my mentors, Sachin Patel, he's always said the doctor of the future is the patient. And what that means to me is we really need to take we need to be our driver of our own healthcare. We don't want doctors to dictate the well side of what we do. Now, some of them are functional medicine providers like me, and we can dictate and help guide them. But I think what's happening is we have to be educated, which is great because we have all these mediums to be educated. But then we also need someone to help guide us through those decisions, because there's a litany of wellness providers out there, and it's a little bit, it can go woo woo, it can go completely science, and you're right, people don't know where to start. And so part of the premise of this place is, what can we do that's safe, effective, does really no harm as best we can, right? What are the things we can do to educate ourselves? And then what are the avenues we can go to if that's something that resonates with me, right? So you can go down a rabbit hole here. If I want to go a rabbit hole down epigenetics, where do I go? So it's like, well, I've studied this stuff for 15 years. And it's like, I'm all over this. And I always go, what does the science tell me? What have I seen in practice? So if I've used things, because it's not always just science based, right? So it has to be a blend of what makes sense in the science, what's been proven. What have I used with little to no harm in practice, like omega-3s? There's probably science to say it's good for you, bad for you. A multivite, good for you, bad for you. Well, you got to go with where your heart is, what you believe, but then you also need guidance. So somebody that's been there a few steps ahead of you, that understands that there is the science piece, like there's a science of wellness here. And then, so how to get started is, I just say wellness made simple. Simple doesn't always mean easy. So take a look at your nutrition, take a look at your sleep habits, take a look at your exercise and movement, take a look at your relationships. What are the ones you need to get rid of that aren't serving you? Because that emotional stress is huge. And just taking a look at your mood and your behavior. So, all your gut microbiome, we're going to talk about all this good stuff that really can help you. But I think it's getting down to basics and understanding some of those things. So like, what are the things you can do is take inventory first, right? Take an inventory of your life and seeing what ones you feel are out of balance on a scale of 1 to 10. You can't rate it a 7 because 7 is okay. Rate it on a scale 1 to 10. How healthy am I eating? And if you don't know if your healthy habits or what to do, well, that's where you start finding people to that are validated in the space, that have some authority in the space, rather than just grabbing somebody that just knows stuff, right? I'm certified in functional medicine as a pharmacist through the Institute for Functional Medicine. All that really means is I'm a niche of a niche, because I was the 9th pharmacist in the world to get certified under that modality from those people. Whereas there's doctors and health coaches and nurses. And so I take wellness from a pharmacist lens or an ex-pharmacist lens and blend that into, which is why we call it beyond the pill. I have a lot of experience in the pill. I can't talk about that pill thing, right? Unless I've already been there and done that. And so now I've gotten on the side of well care and healing and understanding that there's a need for this, but it's not always what we're asking for. So for me, my charge here is, what are the things we can do to minimize or even sometimes free ourselves of these medications? Because how good would that feel, right? Like I said, my mission is to de-prescribe through lifestyle supplementation, personalized care, personal care, to doing these things that we've been doing for a very long time that the science is now proving that can eliminate or reduce the dependency on those things. And that's really what I'm here for. That's why I'm charged up to do what I'm doing.